Oh my gosh, I'm so sorry. I'm so tired.
Oh my, are you feeling okay?
No, I'm completely exhausted. I don't know what to do.
Oh no, tell me about it. What's going on?
I feel like I go to sleep early every night, and when I wake up in the morning, I just feel like I didn't sleep at all. And I don't know what's happening.
How long has it been happening like that?
4 or 5 months now, and I'm so worried because I am irritable all the time. I have this super loud snoring that's waking up my husband, and sometimes it even wakes me up. And I'm tired all day. I almost fell asleep driving the other day because I was just falling asleep at the wheel. I just couldn't focus.
Well, it sounds like you're having a serious problem. Is that the only reason you're here today?
Yes.
Okay.
I don't know what to do anymore.
All right. Well, we'll take care of it for you. We're going to try to figure out what's going on. Based on your symptoms, it sounds like you're having some breathing issues while sleeping. So I'll talk to the doctor. Typically, the next step for this is to do a sleep study. Have you heard of a sleep study?
Yeah, my friend had one done.
Okay. So I'll talk to the doctor. He'll probably write an order for that. We'll discuss your symptoms. Your symptoms, the snoring especially, it's very common for breathing disorders. And all the symptoms you're describing, the day tiredness, all that, it's all related. So hopefully we can get this taken care of for you. And we'll do it as quickly as possible, okay?
Okay, thank you so much.
You're welcome. Sleep difficulties are very prevalent in the U.S. today. 25% of U.S. adults report insufficient sleep for the past 15 out of 30 days. And an estimated 50 to 70 million adults suffer from either a sleep or wakefulness disorder. This affects health in general, and we're going to discuss that, but it also affects sleeping in front of the wheel. So sleepiness at the wheel is responsible for over 1,500 fatalities a year and 40,000 non-fatal injuries. So it's really important. Obviously, it's not only affecting the person who has the sleep disorder's life, it's affecting others as well. So let's talk about sleep and how we study sleep and why we sleep. Scientists for many years have been trying to figure out what the purpose of sleep is. They didn't know if it was just to recharge our bodies, why we needed to shut down for that time. But actually, studies have been showing that your brain is very active during sleep, and it's actually doing things that we need for life. It's creating memories, and it's increasing cognition. It's really amazing what they're finding out. So there's two kinds of ways we study sleep. They do sleep studies that show the sleep detriments and the benefits of sleep. So how they study sleep detriment is they deprive people of sleep and then have them perform tasks and look for deficiencies. And then they have sleep benefit studies where they have two groups of people. One will sleep and they'll see how that helps their performance. So an example of that, there was a study that had test subjects learn a new motor skill. And one group learned the motor skill at 10 a.m. and they were awake until 10 p.m. when they were retested on the same skill. The other group learned the skill at 10 p.m., then slept for the night, and were retested at 10 a.m. The people who slept, they had significantly better results than the people who did not sleep. And this is just one example of the studies that show the benefits of sleep in cognition and memory. So an example of a sleep deprivation study is one study had participants stay awake for a whole night, and then the next day they tested them on their ability to recognize emotion in other people, and they had significantly less success than people who had slept. So, and particularly women had difficulty identifying emotions after not sleeping. So those are some examples of the studies they do with sleep. And some of the things that they found from these sleep studies that are just fascinating is that sleep plays an integral part of memory. So there's a theory out there that we know that the hippocampus is the part that integrates memories. And they're testing this theory that while you're awake, your hippocampus stores encoded information of everything, your experiences, your memories, your new learned information. And then while you sleep, your hippocampus communicates with your cortex, and they replay it while you sleep during all stages of sleep. And then what that does is it not only stores the memories, but it integrates them into the knowledge you already have, and just creates that network of information with association and all that, which is amazing. So sleeping is just such an integral part of our experience and our health. So some of the general benefits that we see according to the CDC, benefits of good health, of good sleep health: your immunity, sugar regulation, cognitive function, safety, because you're not making stupid mistakes, productivity, creativity, and emotional stability, which we've all probably experienced that or seen that in children at least. Poor sleep increases the risk of hypertension, diabetes mellitus, which is related to the sugar regulation, depression, obesity, cancer, reduced quality of life and productivity, and actually all causes of mortality are increased in people with poor sleep health. So as nurses, we need to not only be aware of this for our patients, but for ourselves, because we can make more mistakes on the job, and our cognition will definitely be affected if we are not getting proper sleep. So Healthy People 2020 is the goals for the general population that they want to see take place by 2020. Related to sleep, they want to increase the proportion of people with symptoms of sleep apnea that seek medical help. They also want to reduce the rate of vehicular crashes associated with drowsiness. They want to increase the proportion of students in grades 9 through 12 who get sufficient sleep, and they want to increase the number of adults who get sufficient sleep. So as nurses, we can help achieve these goals through patient education and being knowledgeable about these disorders and factors that attribute to poor sleep health. So there's cultural factors that attribute with the round-the-clock access to technology, just the fact that we have our phones and email right next to us all the time. And work schedules, people who work night shifts and people who work swing shifts, and especially in healthcare, that's a big deal. So I recommend that you try some CAM therapies that might help with your sleep. They call it proper sleep hygiene, and you can go to bed at the same time every night and get up at the same time every morning. That shows to increase your quality of sleep. Avoid large meals before bedtime. Avoid caffeine and alcohol close to bedtime, and avoid nicotine overall. You can use relaxation techniques, aromatherapy, adjust the room temperature and lighting to meet your needs. Dim lights increase melatonin production, and make the noise level appropriate to what you like. Some people like noise, some people don't like noise. So whatever works best for you, adjust so that your body gets in a rhythm, and have a bedtime routine, things you do every night before you go to bed to get your body adjusted. So these are some things you can do to help produce good sleep patterns. All right, so the doctor explained your results of the sleep study to you?
Yes, he said I have obstructive sleep apnea.
All right, great. And you understand what that means?
Yes, I think so. I think I completely understand.
All right, great.
There are 6 categories of sleep disorders. Insomnia is the inability to fall or stay asleep. Hypersomnias are excessive sleepiness. The most notable of these is narcolepsy. Circadian rhythm disorders are when your sleep times are out of alignment. This has to do with your melatonin production. Shift work disorder is one of these. Parasomnias are unwanted experience while falling asleep, sleeping, or waking up. such as sleepwalking. Sleep movement disorders are disruptive movement prior to or during sleep, like restless leg syndrome. Sleep breathing disorders are difficulty breathing during sleep. Sleep apnea is the most common of these. Obstructive sleep apnea is when the patient stops breathing during sleep. This could be caused by the airway being obstructed by the collapse of the hypopharynx or enlarged tonsils or adenoids, a deviated nasal septum, and possibly the narrowing of nasal passages due to allergies or nasal polyps. The brain and the body are deprived of oxygen during these times when the patient stops breathing. The lack of oxygen may wake the patient up a few times to a few hundred times during the night. They may remember this or they may not. There's quite a few causes of sleep apnea. Risk factors for obstructive sleep apnea include a BMI of 25 or higher, a large neck, which could be above 17 inches for men and above 16 inches for women, age, over 40 years old for men and 50 years old for women. Men are at greater risk for this. Smokers, people with high blood pressure, and those with a family history of obstructive sleep apnea are also more likely to have the condition. The most significant symptom of obstructive sleep apnea is loud snoring, but symptoms can also include daytime sleepiness, irritability or moodiness, morning headaches, impaired memory, and impaired concentration. Diagnosis of obstructive sleep apnea can be made by home sleep tests for more mild to moderate cases. This is when you wear a monitor at home when you go to sleep at night, and this way it's more comfortable for the patient sometimes because they can sleep in their own bed. More significant cases of sleep apnea are diagnosed by in-lab sleep studies. This is when EEG is monitored, cardiopulmonary status, EKG, and also muscle movements of the eyes and the rest of the body. Come in.
Hello. How are you doing? My name is Kendra. I'm the nurse here.
Nice to meet you. I'm Laura.
Good. Now, how are you feeling today, Laura?
Still not great. The doctor said I had sleep apnea and I got fitted for a CPAP machine, but I just still feel terrible. It feels so uncomfortable and I feel like there's air leaking out of the sides and it kind of makes me feel claustrophobic and I hate it.
Okay, well, from what I'm hearing, it could be something as easy as the fit of the mask. Do you happen to have your CPAP mask with you?
Yes, I actually brought it with me today.
Okay, well, if you want to, I'm going to get up, and if you don't mind, maybe I can see what's going on, maybe demonstrate how to put it on correctly to make sure that everything's going smoothly.
Okay.
All right, good. Okay. So, first, show me how you put it on.
So, I have it on like this. And then hook it in like this. There we go.
Okay. Yeah, it's kind of hard. I can see that. Well, just even looking at it.
I have a mirror at home.
Okay. Well, just even with this, let me see. Yeah, and it's supposed to be clipped on. Okay, so it looks. Okay. Well, what I'm noticing. Yeah, it looks like it's too big. Do you feel air leaking out?
Yeah, like right here and right here. There's always air leaks. See, I can get my whole hand in there.
Okay, yeah, and so from what I'm noticing, I think this mask might be too big. Maybe that's why the air is not going in correctly. All right, okay, so I'm going to go back and I'm going to talk to the doctor and see what he recommends.
Okay. Thank you so much.
You're welcome. A CPAP is a machine that forces a continuous compression of air at a fixed designated pressure at the face and nose of a patient. When the patient's glottis opens for inhalation, the pressure is transmitted through the airway, helping it to stay open. When the patient exhales, pressure from the deflating lungs and chest wall pushes air against that fixed pressure. An easier way to understand this is that the CPAP machine pumps a flow of air into the nasal passages to keep the airway open. If the CPAP is set too high, it's hard to exhale. It's very uncomfortable for patients because their chest wall and lungs are pressing up against that designated pressure. This can increase the work of breathing. Benefits of using a CPAP. CPAP wearers and their partners report more restful sleep, reduction or elimination of snoring, decrease of daytime sleepiness, a decreased risk of hypertension, lower risk of heart attack, lower risk of diabetes, memory improvement, and improved concentration. A CPAP machine is the most effective way to treat obstructive sleep apnea. It's the first-line choice for adults, but not every person with sleep apnea needs a CPAP. If you have a mild form of this disease, other treatments could be used. But if your disease has progressed, a CPAP is the best form. There are 7 different types of CPAP machines: nasal, oral, full face, nasal pillow, hybrid, and total face. The most common problem with a CPAP machine is that patients don't wear it every night. Even missing one night without your CPAP machine can cause daytime sleepiness. Another reason is that people take off their masks during the night and then don't get their full air pressure that they need to sleep. Another reason could be that patients are afraid to wear their mask. Reasons patients refuse CPAP. The mask could be uncomfortable, nasal drying or stuffiness, skin and nose irritation from the mask, air leaks from the mask, feeling of claustrophobia with mask, inconvenience, rain out, which is too much condensation in mask and tubing, lack of proper education regarding benefits and proper use of CPAP, improper pressure levels cause discomfort, and financial difficulties. Things that can be done to help these reasons patients refuse are humidifier for nasal congestion and mask training. Mask training is huge. So what you can do is during the day, put on that mask, starting maybe with 5 minutes and gradually progress that time. So by the time that you're wearing it at night, your face and yourself are used to wearing the CPAP machine. Another reason could be due to a too big mask or too small mask. So always remember to get your mask fitted before wearing it. And when you are using a CPAP, you need to see your doctor regularly. You also may need more sleep studies to adjust to that CPAP machine and check whether this treatment is working. BiPAP. BiPAP is an optional therapy that patients may need when high-pressure therapy is needed and a patient experiences difficulty breathing against that designated pressure given by a CPAP. It may be used to treat people who can't tolerate CPAP, especially when they can't complain about this exhalation pressure. With a BiPAP, pressurized air is delivered at 2 alternative levels. The inspiratory positive pressure airway is higher and supports a breath taken in. Conversely, the expiratory positive airway pressure is a lower pressure that allows you to breathe out. Okay, Laura, how have you been since we fitted your mask?
Hey, I just wanted to check on you. Have you been sleeping better? I heard you were back.
I've been doing so much better since my mask got fitted. I've been sleeping like a baby. I'm not tired anymore. Life is good.
That's awesome. I'm so happy for you.
Thank you so much for all your help.
No problem.
Talk about it. You doing okay?
No, I'm so exhausted. I don't know what to do. I'm tired all the time.
Redo.
That was so good.
That was perfect.
I thought you were
Good
going to ask
job.
me.
Okay.
Obstructive.
Shoot. Obstructive.
When the patient exhales, That's when the chest of the lungs, and cancel it. An optional therapy for patients with high pressure. Start over.